Welcome to this video about rhabdomyoma, a rare type of heart tumor primarily affecting infants and children. While the word tumor can sound frightening, understanding rhabdomyoma can help alleviate anxiety and provide valuable insights into its nature, diagnosis, and management. Rhabdomyomas are almost linked to a genetic condition called tuberous sclerosis complex, or TSC, is caused by mutations in the TSC1 or TC2 genes. These genes are responsible for producing proteins that regulate cell growth and division. When these genes are mutated, it leads to uncontrolled cell growth, resulting in the formation of tumors in various organs, including the heart. In most cases, the presence of cardiac rhabdomyomas is a key indicator of underlying TSC. Now, let's delve into how rhabdomyomas affect the heart. These tumors are typically located within the heart muscle itself, most commonly in the ventricles. Their presence can disrupt the heart's normal electrical activity, potentially leading to arrhythmias, or irregular heartbeats. The size and location of the tumor also plays a vital role. Large tumors can obstruct blood flow within the heart, leading to heart failure. In severe cases, this obstruction can even affect the baby during prenatal development. Rhabdomyomas are rare, with estimates suggesting they occur in about 1 in 10,000 live births. However, it's important to note that the prevalence of rhabdomyomas is significantly higher in individuals with tuberous sclerosis complex. Around 50 to 80% of individuals diagnosed with TSC will also have cardiac rhabdomyomas. This strong association makes rhabdomyoma a key diagnostic clue for TSC. The signs and symptoms of rhabdomyoma can vary depending on the size, number, and location of the tumors. Some individuals may be asymptomatic, meaning they experience no noticeable symptoms. In others, symptoms may include heart murmurs, detected during a routine check-up. Arrhythmias can manifest as palpitations or, in severe cases, fainting. Heart failure can present with symptoms like shortness of breath, fatigue, and swelling in the legs, ankles, and feet. In newborns, heart failure can also manifest as difficulty feeding and poor weight gain. Diagnosing rhabdomyoma typically involves a combination of imaging techniques. An echocardiogram, which uses ultrasound to visualize the heart, is the most common and effective diagnostic tool. It allows doctors to see the size, location, and number of tumors. A fetal echocardiogram can sometimes detect rhabdomyomas even before birth. An MRI of the heart can provide additional detailed information about the tumors. Genetic testing is crucial to confirm the presence of tuberous sclerosis complex. This testing can help identify mutations in the TSC1 or TSC2 genes. Rhabdomyomas are not typically classified into different types, in the same way that some other tumors are. The primary classification factor is generally based on their location within the heart, e.g., ventricular, atrial. The number of tumors, single or multiple, and their size are also important considerations in determining the best course of management. Treatment for rhabdomyoma depends on the severity of symptoms and the size and location of the tumors. Many rhabdomyomas spontaneously regress or shrink over time, particularly during the first few years of life. In these cases, close monitoring with regular echocardiograms may be the only treatment needed. Medications, such as antiarrhythmics, may be prescribed to manage arrhythmias. Medications to manage heart failure, such as diuretics and ACE inhibitors, may also be prescribed. Surgery to remove the tumor is typically only considered in rare cases where the tumor is causing significant obstruction or life-threatening arrhythmias. A newer treatment option involves MAOR inhibitors, medications that target the protein pathways disrupted in tuberous sclerosis complex. These medications can help shrink tumors and improve symptoms. Currently, there is no way to prevent rhabdomyoma itself, as it is genetically determined by tuberous sclerosis complex. Genetic counseling is essential for families with a history of TSC to understand the risks of passing on the condition to their children. Prenatal testing may be available to detect TSC during pregnancy. The prognosis for individuals with rhabdomyoma is generally good, particularly if the tumors are small and asymptomatic, or if they spontaneously regress. With appropriate management, including medication and monitoring, most individuals with rhabdomyoma can live normal, healthy lives. Ongoing research is focused on developing more effective therapies for tuberous sclerosis complex, including targeted therapies that can shrink tumors and improve overall health. Studies are also exploring the long-term outcomes of individuals with rhabdomyoma, aiming to better understand the natural history of the disease and optimize treatment strategies. The use of mTOR inhibitors in treating rhabdomyomas associated with TSC has shown promising results in reducing tumor size and associated symptoms, offering hope for improved outcomes for affected individuals.